There's more bad news this evening about this country's diabetes epidemic. 26 million Americans suffer from type 2 diabetes. Most of them are adults, but the number of young people with the disease is growing fast. And now, researchers have found that a key medication for treating it in grown-ups often fails in teenagers. Here's Dr. John LaPook.
21-year-old Sarah Chernov checks her blood sugar every day. One of many changes in her life since being diagnosed with type 2 diabetes at age 16.
It's definitely troubling for anybody who's dealing with such a chronic disease to keep yourself on track, especially when you go through the phases of denial and understanding that this is, a chronic disease.
Since 1980, obesity in children has almost tripled to more than 12 million. And that, says Dr. Robin Golan, who helped run the study, has fueled a rise in type 2 diabetes in young people.
Historically, childhood diabetes has not been type 2 diabetes, so very little is known about the right way to both prevent it and to treat it.
Medications that control blood sugar lower the risk of patients developing complications such as poor circulation, blindness, and kidney disease. But the most commonly prescribed drug in adults, metformin, failed more than half the time in the young patients in the study.
We could prevent them from getting diabetes. That would be far preferable than being in the position of treating it.
That's been the goal in New York City, which has been waging an aggressive anti-obesity campaign for years, taking measures such as posting calorie counts on menus and banning sugary drinks from public schools. Health Commissioner Dr. Tom Farley says willpower alone is not enough.
We're going to have to try to engineer physical activity back into our daily lives. Second, we're going to have to increase access to healthy foods like fruits and vegetables and reduce the availability and promotion of the calorie-dense snack foods that make it so easy for us to consume too many calories.
And little is being done in our nation's high schools to help. Only 17% of students get the recommended 1 hour of moderately vigorous physical activity each day.
John, you said a little over half of the teenagers are benefited by metformin, the rest are not. What do the rest do?
Scott, a lot of them eventually are going to end up on insulin, and that could be for the rest of their lives, which is why prevention is so important. And programs like the one that Commissioner Farley is doing in New York City, even though they may be expensive, cost little money now up front, are a great investment because the total cost of obesity plus diabetes in the United States each year, $340 billion.
Lose weight. John, thanks very much.